sclerosis, also known as MS, is a long-lasting chronic disease of the central nervous system that affects the brain and spinal cord. It is thought to be an autoimmune disorder, a condition in which the body attacks itself by mistake, eating away the protective covering of the nerves, thereby disrupting communication between the brain and the body. It is an unpredictable disease that affects people differently, causing a wide range of potential symptoms. Some people with MS may have only mild symptoms. Others may lose the ability to see clearly, write, speak, or walk when communication between the brain and other parts of the body becomes disrupted. It is a lifelong condition that sometimes causes serious disability, although it can occasionally be mild. Today on your regular Health Talk TV show, The Physicians, we'll be discussing multiple sclerosis, the risk factors, the causes, the preventive measures, and of course, possible complications. Stay tuned. It's another day with the physicians where your health is our business. Today we'll be discussing a very interesting topic, though not so common, but it is there, known as multiple sclerosis. Short abbreviation is MS. My name is Dr. Martina Agberian, your regular anchor on this program. And of course, as usual, I'm not alone. I'm with my very, very delectable, ever pretty.
I'm Dr. Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business and will always be our business.
I love that. It will always be our business. There's no going anywhere.
We aren't going anywhere.
Yeah. Dr. May, multiple sclerosis.
MS.
MS.
You know, there's some names in medicine that when you hear, you'll be fascinating about them, like, oh, multiple sclerosis, MS, and you're like, but we know that this is not a good thing. It's a problem.
It's a real problem. Yeah. Considering the damage, the extent to which it goes. You really don't want to see a patient that comes to you with MS. Gradual and helpless.
That is my own issue when it comes to MS. Like the fact that it comes like a thief in the night.
Glaucoma?
Gradually starts taking over, gradually. And you know, this is
what baffles me is an autoimmune disease,
yes,
right?
It is.
And your body is fighting back. But this time, it's not even fighting back or eating up other parts of the body rejecting it. The covering of your brain.
We've had a very bad case. I remember the doctors then calling the relatives, like, you know, the way you see it on TV and say, come and say your last wishes, or come and, that it's not like this is not, it is what it is.
This is what it is. Just accept it.
Yes, accept, exactly. And then encourage them to, whatever the person, that it was their dad. Yes. Wishful, anything he has wished for, anything he needs to, that he needs now, they should do it. I know, as a young house officer, like, you're just sitting there and just like, this is how life just comes and goes. It's like somebody's giving you, just turn off the light and good night.
Well, real good nights. I just hope that, well, with technology, let's wait for the consultant,
to come in.
Coming. Maybe there are some things that we're not aware of now that
recent trends,
Okay, so we'll be back after the short break. Just ensure that you have called somebody, inform your family, friends, and colleagues that the physicians were live, were on, so that you can be part of this program and listen to this very interesting episode, Multiple Sclerosis. We'll be back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome to your favorite health TV talk show, The Physicians, where your health is our business. Today we're discussing multiple sclerosis, and in the studio with me is Dr. YETUNDE ASHIRU. She is a neurologist with the Lagos State University Teaching Hospital. Doctor, you're welcome to our program.
Thank you very much.
You're welcome once again.
Thank
Lovely
you
to have
much.
you here.
I just love your smile. So.
Very comforting.
Yeah, so I want to talk about multiple sclerosis. And I'm sure when you were a medical student, when you heard about multiple sclerosis, something actually go down. Now you are a pro neurologist, and this is your field. So it would be very nice and appropriate to let our audience know something about multiple sclerosis. So what is multiple sclerosis?
So multiple sclerosis is actually, it can be a devastating disease. It's an autoimmune disease, meaning that the body fights against itself and it destroys the cells of the brain and the spinal cord, which the central nervous system. So it has a particular predilection for the covering of the neuron. So what happens is that the way the neurons are, let's look at it like the electrical cable. It has, the cable carries the electricity, and we have an insulating material around this cable. That's how the normal cable is designed. So the same way the brain is designed that way, the insulating materials are called the myelin. So multiple sclerosis is actually a demyelinating disease of the CNS. So what happens is that there is inflammation. So there's swelling, there's destruction from all the cells. The body is supposed to, protect itself. The immune system is supposed to fight against other things. And when bacteria come into our system, all the bugs, viruses, it fights against it. So that's our immune system. But sometimes the immune system, the fighting system, becomes haywire, and it now fights against the body itself. So we say it's autoimmune. Now in this case, the autoimmune is attacking the brain, the spinal cord. Now we shouldn't forget that the eye, the optic nerve, is like an extension. The nerve that controls the eye is an extension of the brain, so it's also affected. So it affects the optic nerve, the brain, and the spinal cord.
So you said, you used the word haywire. That means that it's not doing its own thing. It's not following the protocol and the processes anymore. So what can cause multiple sclerosis, and who are the people that are more at risk?
So there are several theories surrounding it, several reasons why the immune system goes haywire, like I said. One of it is that there's usually like a genetic predisposition, and then some environmental interference. Some people say infection with Epstein-Barr virus, that's one theory, leads to dysregulation of the immune system, and it stops recognizing the cells that this is what I'm supposed to recognize and take care of. And instead it sees it like a threat and starts destroying it. So multiple sclerosis is usually common. It used to be they used to say that it's common in the temperate region and less common here. But of recent now, because of the advances in technology, with the MRI technology here, we're seeing it that is actually of concern in this part of the equator. So initially it used to be thought that it's more in the temperate region. There's also another theory that says that vitamin D level, because low vitamin D level, or those that have an abnormal gene of the vitamin D, increase predisposition to multiple sclerosis. But we know that most autoimmune diseases are commoner in females. So it's commoner in females, usually in their 20s to 40s, but it can be seen in men too. And so yes, it's commoner in females. In the reproductive age,
the age where you're very fruitful, very active, that's when it usually strikes. But it can occur in you also.
Okay, so at the beginning you said it's actually a demyelinating disease, right?
Yeah.
And that affects the brain.
Yeah.
And we know the brain, the spinal cord is an extension of the brain. And it also affects the optic nerve, right?
Yes.
So it would be nice for us to know the presentation. When these things are affected, when this area is affected, how will the patient, the individual who has multiple sclerosis, how will they present? How will we recognize that it's actually MS?
Thank you very much. So the presentation is usually varied depending on the parts affected at that site. And the interesting thing about it is that it can run a relapsing and remitting course. So this year, it can affect the eye. So the patient is just having sudden inability to see. Usually one eye. Person is not seeing properly with one eye. And after a while, say 2-3 weeks, it starts improving. Sometimes they present with paralysis. They just, wake up and over a few days, they can't move, they can't walk. It can be full paralysis, the whole body. It can be maybe just the lower limbs. They can't control their bowel, they can't wee on their own, they can't poo on their own. So sometimes it can just present that they are shaking, they are unsteady, they can't move properly, their eyes are shaking, their voice, they can't talk properly. So depending on the part of the brain affected, it presents with different kind of symptoms. So the usually presentation is the optic neuritis. So they present with inability to see. And the sad thing about it is that when they go to the eye doctor, if they check, everything looks normal because it is behind the eye. It is retrobulbar. So there's this phrase that the doctor sees nothing, the patient sees nothing. You can't see, but they're looking into your eyes and everything looks normal. So it rings a bell that this may be behind the eye. And they ask for a brain scan and they see the plaques in the optic nerve. So they may have the presentation and after a while they get better. Like 2-3 weeks they get better and they do well. So that may be the reason why some people don't present on time. They have this relapsing remitting course. They may not even do anything. Some will even go to prayer houses. Yeah. And after 2-3 weeks, they think they are better and they think it's just the prayers. It's the way the pathophysiology of the disease is. But later on, it leads to accumulation of this deficit. And then they have no choice but to present.
Well, you said it affects the females most, right?
Yeah.
Okay. So,
Sadly.
yes.
Sadly.
Sadly. But we're coming to terms with it actually. Yeah. And most of these things actually affect the females most likely because of hormones, right? Yeah. Okay. So is there any age that is affiliated with it? Variation? Children, just adults, elderly?
So it can occur in childhood, but however, the most frequent age bracket is between age 20 to 40. Though it can occur in people younger than that, can also occur in people older than that, but usually it's that range.
Okay, so there's between age 20 and 40. And like I said, there was a colleague, okay, who had multiple sclerosis, and it was just continuous. From one inability to speak, his hospital was still a bit distorted. She couldn't see properly. She couldn't even coordinate in writing. After a while, we could see that she couldn't write properly. The writing was not just going, it was found scratch. She couldn't move. She was now bound to a wheelchair. Okay? Is it that this situation, is it just progressing and there's no relief at all? So what are the things that one should be able to even use to slow down this progression?
It's a neuroinflammatory condition. So it means that there's a lot of inflammation going on and it affects different parts of the brain. So there are plaques formed in different aspects of the brain. So that's why there are different forms of multiple sclerosis. We have the relapsing remitting type. So in that type, what happens is that a plaque is formed around so the inflammatory plaque is formed around a particular part of the brain. The patient presents with symptoms suggesting there's a problem at that part of the brain. And then another plaque is formed at another point, few months or few years later. Patient presents with that just everywhere. So it can go from the brain. It has predilection for a particular part of the brain and also for the spinal cord. So when they keep having this, they have an improvement. So usually the typical history is that 2-3 weeks, the inflammation subsides and there is improvement. But sometimes they may not have total improvement, so they keep accumulating the neurologic deficits, the weakness. So like it affected your eyes, the eyes got better, but can still have some abnormal, thing that the patient is not seeing properly. Then it goes to the hand, it goes to the leg, just like that, and it can cripple them. So we have the primary progressing type. So that one just goes straight. They keep, they never get better from one symptom to the other. It just keeps putting the inflammatory plaques everywhere in the brain. So, and they keep acquiring the deficit and they just keep going down the drain. Now we have another type that initially they have the symptoms, it goes. They have the symptoms, it goes. Then later they have the symptoms, it doesn't go. We call that the secondary progressing type. So we have the relapsing remitting, we have the primary progressing, we have the secondarily progressing. So there are other in-betweens anyway, so we really don't need that. But at least those are like the 3 main forms.
Wow.
How do we make the diagnosis?
Yes.
It's usually with an MRI scan. Magnetic resonance imaging scan is what we call the MRI. It's a scan that the person goes into like a machine. They scan the brain and the spinal cord. Now I talked about the plaques. The plaques are formed in different aspects of the brain. The plaques are usually neuroinflammatory material, and there's destruction of the neurons. So with time, it affects the neurons itself and destroy the neurons. And the patient will even start having neuronal loss and neurodegeneration. So the neurons are lost and there's nothing you can do about it. So they can see it in the brain and in the spinal cord. And then aside that, we can also take fluid from the back during a lumbar puncture. Yes, cerebrospinal fluid. And we take it to the lab and do what we call CSF oligoclonal bands. So in 80% of patients with multiple sclerosis, 80 to 90%, they would have a positive CSF oligoclonal bands. So those are like the 2 main criteria we use. 1, dissemination in time and then dissemination in space. So time means it happens like a year ago, the patient is having another symptom this year ago, or you see some plaques in the brain and you're seeing some plaques in the spinal cord. That's at different ages. So there's a way we look at it and the radiologists know the age, as in the ones that are recent, the ones that are old. So in time too, is that CSF oligoclonal band. It is a marker of chronic inflammation. Okay. Remember, it is a CNS inflammatory condition. So the CSF oligoclonal bands, they are proteins that are produced from chronic inflammation. So we use that and the MRI. So apart from your MRI scan, your doctor may ask to take a fluid from your back that they take to the lab to check for CSF oligoclonal bands. That's how we make diagnosis. Now for the treatment.
So before we go into treatment, right?
Yes,
so are we saying that it's only MRI, the CSF oligoclonal band? These are diagnostic when it comes to ensuring that we are going to make a diagnosis for multiple sclerosis after seeing the clinical presentation, and you are now trying to back it with laboratory investigation. These are specific for it. So apart from any other ones, these 2, they're the ones that you are very sure. Or one or either one, both.
Usually both. because there are lots of CNS inflammatory, neuroinflammatory conditions that can mimic multiple sclerosis.
Okay.
We have neuromyelitis optica spectrum disorder. It also presents with blindness and weakness.
All those things. Okay.
We have MOGAD. We have ADEM. We have a lot of them that can mimic multiple sclerosis. So we need the scan. And we have a criteria called the McDonald's criteria.
Please
that we
expatiate
use.
on that.
The McDonald's criteria?
Yes.
McDonald's criteria.
Yes, so it makes use of the typical MRI findings and the CSF oligoclonal bands, and then your history that is demonstrating that the patient has features. Suggestive of MS.
Okay, go to the
treatment.
All right, so for the treatments, we have the acute treatments. We also have the, long-term
maintenance
treatment.
and long-term treatment.
Because it's not something that is curable. It's not like malaria, that you just take anti-malaria and you get fine. It is a chronic disease, and it's just something you have to keep managing. So there are specific treatments for when the patient has a flare. So when the patient presents acutely with a weakness, we say it's a flare. What we do is that we give intravenous corticosteroids. But at particular dose, and there's a way we follow it and all that. We give it for a particular time, and then we now change to our follow-up treatments. There are disease-modifying medications for multiple sclerosis. So that's the advancement of technology we're talking about. That now there are more drugs that we can use to treat it, and we can approach it at different points. So what the disease-modifying medications do is that they prevent you from having recurrent plaques, especially in the MRI plaques. So, and then as the person is not having the recurrent plaques, the body tries to heal itself, and so you have a better outcome in life. And don't forget, because it's the CNS, it affects every part
of the body.
So other things will come up. Apart from the MS itself you are treating, they can have mood issues, they can have bladder issues, they can have problem with feeding.
So multidisciplinary
yes, you need a physiotherapist, the occupational therapist, you need a psychologist, and you need the other medications too to help with all these complications that can arise.
Okay, so as a neurologist that is actually still in practice, how often do you see this patient? Is it common?
It's actually very common.
Now,
wow.
Yes.
In those days,
like what kind of percentage?
Because we didn't know much about the diagnosis.
Yes.
So now it's common.
So with the advancement of MRI and with the knowledge, so we now diagnose it often. So
once a week, once in a month.
Yes, like maybe maybe say 3 to 4 patients in a month.
Wow, that's high.
Yes.
So in a year we're talking about 36, 40.
Yeah. That is even those
that's
that
in one center
themselves
for diagnosis. Yes.
Most people they don't even present on time because.
Okay, Dr. ASHIRU, our time is almost actually up, but I want you to give one word of advice, so just your parting word, and I'm sure you also have support groups, right?
Yes, there are support group for multiple sclerosis. I'm not sure of, I know one in Nigeria, and great. she is actually trying to do a lot of work to create awareness. And also,
we would love to bring her on board.
We would love to bring her on board if you have access.
I think I would ask and get back.
Okay, please. Thank you very much.
Yes,
so final words.
So I would like to say that multiple sclerosis is real. It is not a myth. It's not from the spirits like we always think in the country. It is manageable if the patient presents on time before they accumulate a lot of neurologic deficits. So we advise the public that when they see people with weakness, with difficulty in seeing, they should please present themselves to the specialist on time.
Thank you very much, Dr. ASHIRU, for coming on our program, and I really appreciate you. We've gained a whole lot. I'm particularly excited knowing that you have support group, they have support group, And people actually present now, unlike in the past when we thought it was not
Exactly.
that common. Thank you very much. And to all our audience, I'm sure you have actually benefited from what Dr. ASHIRU said. Multiple sclerosis is an autoimmune disease for no fault of the individual. For those that have been diagnosed and you have your families, please support them. They need that care, they need that love, because it affects all parts of the system. They're not pretending, it's actually real. So I want to appreciate you for keeping a date with us again, and same time next week. Let's always be available to watch the physicians. My name is Dr. Martina Agbere. Stay blessed.
Thank you very much, Dr. ASHIRU. It's always amazing when you come on board and you school us on things that people just ignore, or they find it difficult to present themselves, but you make it so easy to relate to. Thank you once again. To our viewers out there, you've heard it all from our expert in the studio. Be kind enough to follow us on all our various social media platforms so you do not miss any information. On this show, The Physicians, we aim to ensure we give you the right information to reduce misinformation and disinformation. The very authentic information that you need from the experts, this is the only station that you get it from. On this note, my name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplements for you and me. In your body, that I fight you.
Daravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Daravite from LB Pharma. Daravite, love yourself.